The demand for beds here in the province of Gauteng has hit crisis level. This according to the South African Medical Association, which says the delay in COVID-19 vaccine drive is overburdening hospitals. For more on this, we're joined by SAMA's Angelique Coetzee. She speaks to us from Pretoria. Doc, very good morning to you. So, if I were to just give you the chance to explain to us or describe the situation in our hospitals right now, specifically in Gauteng, how would you describe it?
Horrendous. It is extremely stressful. It is stressful for us, the referring doctors, to a hospital to try to get a bed, even only to refer a patient to casualty that you know are positive. Casualty will tell you, most of the private casualties will tell you upfront that they're not going to take the patient as they don't have beds. And you will then need to start to call all the casualties that is in specific town or city like we are in Pretoria. It is very, very stressful to do that, because you are sitting with the patient. You as the doctor are sitting with the patient. There's no beds. To get permission to get oxygen, if that patient, if you want to put the patient on home oxygen, is just as difficult.
Yeah.
The medical schemes are over-inundated with requests, so you end up, I now have to wait 2 days for 2 patients to get oxygen, home oxygen to them. They actually need to be admitted, but there's no beds.
Have you gotten to a stage, doctor, where you're turning away patients? And make this clear for us. Are we talking public hospitals or private hospitals as well?
We're talking private hospitals. And from my side, I had to tell patients, we cannot admit you. I know that you are extremely sick, but there's no beds. So you can phone any of the casualties in Pretoria, asking them for a bed, and I presume it would be the same in Joburg, asking them for a bed for a COVID-19 patient. They will tell you there's no beds. The problem is patients think that they can get into the casualties via an ambulance. The same happened to the ambulance people. They also need to start phoning around. So in the end of the day, you end up phoning different hospitals to be telling the same story, there's no beds. So you are sitting with a patient, and I promise you, there's nothing as worse as being a general practitioner, sitting with a sick patient, no beds, you've got the family on you, you've got everyone on your back, but there's no beds. So this brings me back to the question, are we really prepared for this third wave? We were supposed to make sure that we have enough oxygen ports, that we have enough oxygen cylinders, that we have enough beds and staff out there. So private practice or the private hospitals are struggling, and I can promise you it will not be much better in the public sector.
Dr. Coetzee, you are really, you're raising alarm here, and I wonder if we are back to the exact same situation right at the beginning. This is in March last year at the declaration of the hard lockdown, where doctors were forced to make hard decisions about who to give oxygen to, in terms of, this is a young person, they still have, years of life to live, versus an old person. Is that where you are taking us? And if so, that means that authorities, at least in this province, have not prepared adequately for this third wave.
Well, we're moving in that direction. And, SAMA started to warn about 2 weeks ago, a bit more than 2 weeks ago, that we are unofficially in the third wave. It took National Department of Health and the Macron vaccines another 2 weeks before they only declared it last week as a third wave. We already saw by that time, because we use the index of hospital beds, positive patients, and the number of patients that went for COVID-19 tests. So that was already increasing 2 weeks ago, and now we're sitting. We are, it's heartbreaking. Also, you need to understand that doctors working in the hospitals, and again, I can speak on behalf of the private doctors, the specialists, it is like, deja vu. You are put back exactly again in the same situation that you were in December and in June last year. Now, let me tell you, if you are a medical doctor and you are put back into that same situation, the way that you feel, the uselessness, the emptiness of knowing I'm going to go through this again, and the helplessness from a doctor's side, and you know what this patient needs.
Oh, technology failing us right towards the end of this important conversation. Dr. Coetzee, I think you are back. Am I correct? Can you hear me? All right. I think we've lost Dr. Angelique Coetzee. All right, Doc, I'm told you are back. Let me give you a chance to complete your thought. You were describing the situation where doctors, for lack of a better term, in terms of what we have been reading in the papers, where doctors, right at the beginning of the pandemic, were forced, quote unquote, to play God.
Yeah. We're back in that situation again. We're moving into that situation in the private sector. I'm not sure how far we are with that in the public sector, but I promise you, it's not easy. It is extremely traumatic for you as a medical doctor to know what you can do for a patient. But again, due to lack of hospital beds, apparently there's enough oxygen in the hospitals, but it's to get a bed. And a bed means a doctor and a nurse. So we're back in that dilemma again. Patients are currently in Pretoria. Most of the casualty units that are lying in the casualty units, occupying beds there, as there's not enough beds in the ICU. You literally have to wait for someone to die to take a bed up in ICU.
Yeah. Dr. Coetzee, let's end this conversation with your appeal to members of the public. Vaccine delays are partly to blame here, but what is it that we have to do as ordinary citizens to protect ourselves and lessen the stress on you, the doctors?
Please vaccinate, vaccinate, vaccinate. Wear masks at home when you go and visit families as well. Masks, social distancing. I cannot stress this enough. It's not happening. I know people are out there had enough of COVID measurements, but you have to do it. We don't have a choice.
Dr. Angelique Coetzee, she speaks for the organization South African Medical Association. It's a desperate situation, so please take caution and listen to the doctor's words.